Hello, welcome to this webinar on egg donation. My name is Aaliyah. I work at Egg Helpers, and I'm joined today by Amber, a experienced donor, as well as a journey guide on our team, and Dr. Prati Sharma, a double board certified OBGYN and reproductive endocrinologist at Create Fertility. Now, I want everyone to kind of introduce themselves. So, Amber, if you want to talk a little bit about you, your role, your experience donating.
So I am Amber. I have worked at Egg Helpers for 8 years now. I am an intake specialist, and I am here to help you in your first beginning stages of your egg donation. I've also been a 2-time egg donor myself, working with both anonymous and a known donation. And yeah, I'm excited to get started.
Amazing. And Dr. Sharma?
Hi, everyone. Nice to meet you. I'm Prati Sharma. I'm a reproductive endocrinologist and infertility specialist. I've been in practice for over 15 years. I practice at a large downtown center and have been doing what we call third-party reproduction, which is using an egg donor surrogate or a sperm donor for a very long time, and have had the pleasure of working with many intended parents, egg donors, and surrogates. And have seen people through a number of cycles, and very excited to be here to talk about the science and the medical piece of egg donation.
Amazing. So the biggest question I have is why does egg donation matter? So can we talk a little bit about this path to parenthood? Dr. Sharma, who do you see coming to your office needing an egg donor or having this option available to them?
Yeah. I mean, I always say there's so many ways to build a family. And so we're so lucky to be in this era where you can build your family in a non-traditional way. And so that brings us to egg donation. And so typically it's a couple of groups of people who would need an egg donor. One is someone who's sort of gone through the biological aging of their eggs. So when we talk about reproductive aged people, we usually say it's from like 15 to 45. So once you get to 45 plus, we know that age affects egg quality, egg number, and egg health. And so over the age of 45, just based on age alone, many women who want to build their family don't have the robust, viable eggs that they need to be able to have a viable, healthy pregnancy. So that is a very common group of people who need donor eggs. Now we use the age of 45, but a woman can sort of deplete her own personal egg reserve anytime after 40. And sometimes we see women who go into premature menopause or premature ovarian failure under the age of 40, and they need to use an egg donor. And the reason for that is they need younger, healthier eggs. And so one is an ovarian cause or an egg cause. The second group of people is people who just don't have the eggs to work with. So what I mean by that is a same-sex male couple. So two guys, they have the sperm, but they need eggs and a uterus. And so that's also a very common group of people who need to use an egg donor because they need someone to donate their eggs to be the half of their child. They have the sperm, they need the egg, and then they need someone to carry the baby. The third group would be someone who's had their ovaries removed, but they have their uterus, so no ovaries at all, and that could be a younger female or an older female, and they need donor eggs. And finally, the fourth category I'll mention is it could be someone who's young with good ovarian reserve, but they have some sort of genetic mutation in their own eggs that's going to propagate to their child. And so because the risk is too high, the genetic burden is too high, using an egg donor, like changing either the egg or the sperm, typically if the person who has the genetic mutation is the female, changing the egg can give you a healthier chance of having a viable, healthy pregnancy. And there's probably other outliers, but these are the major groups.
No, that's so helpful. And then Amber, from your perspective as someone who's been an egg donor before and also someone who works in this space, what are some reasons why egg donors become egg donors, or what are some of the motivators behind it, or what was maybe your own personal motivation for becoming a donor?
Yeah, so I've worked with women from all over the country. We work with young women who are maybe students and maybe they don't see themselves having children in the future, but they want to help. I work with a lot of women who have personally been affected from loved ones, friends, family members who have gone through fertility issues or unable to conceive. And so it hits them personally. And if they're healthy and able to. They want to be able to give back and help. Me personally, I'm a mom myself, and I couldn't imagine my life without my children, and I want to give that gift to other people. So anyone who really is just has it in their heart that wants to help is amazing, right?
Totally agree. That's so beautiful. And when we talk about egg donation, I think that there's a lot of misconceptions and misunderstandings about how this really works. And I think a lot of that comes down to understanding our own reproductive cycle, our own menstrual cycles. So, Dr. Sharma, I was wondering if you could help us debunk the myth of like egg donation reducing fertility or depleting your egg supply. And then also to just give us, maybe to start off with, a bit of an understanding on the menstrual cycle and what that looks like for someone.
Yeah, absolutely. So the quick and dirty, or the fertility 101. So um, typically women are born with a certain finite number of eggs. And so you have about 1 million at birth, a couple 100,000 at puberty, and that goes down to 100 at menopause. So throughout life, a woman is using and losing eggs, meaning that regardless of ovulation once a month, eggs are growing and being depleted all throughout your life. And that's actually the way that you get to menopause. It's not the one egg that you ovulate every month. So just because you take the birth control pill doesn't mean you're saving up all your eggs. You're losing some throughout your life just from random growth and what we call atresia. And so each month, at the beginning of the month, you have like a group of eggs that is sort of ready to go. And so when you're younger, you have a lot more eggs available. And that kind of is why younger women who are egg donors have more eggs to offer in a cycle. And so that number goes down as you age. So a 42-year-old might have like 5 eggs at the beginning of her cycle, whereas a 32-year-old would have 20 eggs at the beginning of her cycle. And what I say to patients, and this is not just egg donors, but any patient who's considering fertility treatment or IVF, it's use them or lose them for every month. If you have 20 eggs at the beginning of your cycle, those eggs are gone, regardless of if you take the birth control pill, if you do IVF, if you become an egg donor, if you do absolutely nothing, if you try to conceive or not. You lose those eggs. They're all gone by the end of the month. And so you're actually just rescuing eggs that would be otherwise doomed to depletion that month. So all to say that if you do an IVF cycle or stimulate an ovary and get eggs out, you're just saving eggs that would have been otherwise destroyed. So you're not really taking away from your pool because those eggs would have been gone anyway.
No, that's super helpful. So all of these questions, like, will I run out of eggs in an egg donation cycle? Egg donation, does it reduce my fertility? Does it cause early menopause? No, it doesn't do any of those things. It's really just rescuing those eggs. So that is super helpful. Thank you. And talking a little bit about the menstrual cycle too, I want to know a little bit more about, in a natural cycle, what our hormones are doing. How do we grow to ovulate an egg? And then in a donation cycle, how do those hormones differ, maybe?
Yeah, great question. So we're kind of magicians where we manipulate the normal menstrual cycle and fool it into doing something different. So as you said in your slide, normally what happens in a natural cycle is early on in the cycle, you have 2 hormones that are produced by the brain, FSH and LH. And those start being produced at the beginning of the cycle and go up until ovulation, and that's stimulating your one egg to grow. So your body makes enough hormones to have like a leader of the pack grow and ovulate. What we do is we surpass that FSH threshold, and by giving what we call exogenous hormones, so hormones from the outside in the form of injections, we're fooling the system into getting multiple eggs to grow, not just one egg. And so we override the system and we say, okay, let's ovulate multiple eggs by giving you extra medication. So those are the hormonal injections, the FSH and LH hormones that egg donors take. And that allows you to make multiple follicles. We call it multifollicular development, fool the system, and make 15 to 25 eggs ideally. And so it's different than a natural cycle in that in a natural cycle, you only have one ovulate, and in a stimulated cycle, you have 15 to 20. And so I always get a lot of questions like, why do you want 15 to 20? Like, why do you have to do that? Why can't we just get the one egg and like hope it's the perfect one? Well, we know that even for egg donors, and particularly for women as they get older, that one egg is not going to necessarily be perfect. In fact, there's probably only a 60 to 70% chance the one egg is perfect. And if you stimulate only one egg, you might not get an egg when you do the retrieval. It's not a perfect system. It might not be mature. It might be over mature. It might be under mature. And so you don't want to put a patient through this 10 times. You'd rather maximize your egg yield in one egg retrieval. Now, obviously, you don't want to go overboard. That's why we say 15 to 25 is the ideal amount.
No, that's fantastic. And so there's nothing that's like necessarily unnatural about these hormones that you're using. They're all hormones that would be occurring within a cycle.
Yeah, I mean, it is certainly a medicated cycle, right? Like it's not a natural cycle for sure, but it's just taking advantage of the menstrual cycle to make it make more than it usually does. So yes, in some ways I would say these aren't synthetic hormones that are totally different from your natural hormones, but they are made in a lab. They're either purified urinary hormones or they're made in Chinese hamster ovary cells or human cells and engineered, but they're manufactured to be exactly like the hormones that you make in your own body.
That's fantastic. So we've learned a little bit about what egg donation is and who might need an egg donor, but who can become an egg donor? There's so many qualifications, it seems like, and I want to know a little bit about why. So, but before we get into the why, maybe Amber, do you want to talk about, I think they're listed here on the screen, but like some of the top qualifications that you kind of look for in an egg donor when they're coming to this program?
Yeah, so for us, we're definitely looking for someone who's between the ages of 19 and 32. It'd be ideal that you live a pretty healthy lifestyle. So definitely being able to sustain from alcohol, tobacco, any drug use or anything like that is very important. We will also ask about some hereditary diseases that can run through your family. Medications can also play a big part as well. So just being open and honest and kind of having that conversation just to ensure that we are making the right choice together for your safety, the intended parent's safety and health, and everything that goes into the whole process.
Fantastic. And as an agency for egg donation, we have these qualifications, but we don't just have the qualifications because we decide to make them up. They actually come from a medical background. So, Dr. Sharma, I'm hoping that you can explain a little bit why some of these qualifications exist, like who is it protecting? And yeah, could you just talk a little bit about that?
Yes. So, I think we all feel like, an egg donor is doing this incredible like service to patients. And it's really true. Like going through IVF is not easy. I'll never minimize it. I've done IVF myself, so I know how it goes. So we're incredibly grateful to egg donors who like volunteer to do this. But at the same time, yes, we need criteria because remember, on the other side, these are intended parents who are not using their own gametes. And, these are expensive cycles. So we have to have some parameters for choosing what egg donor makes sense. And so that's where everything you listed, like the age requirements, we usually say it's between the ages of 18 and 34. And again, it's because of what I said before, egg reserve. If you're too young, you don't have as healthy eggs. If you're too much over 34, your risk of having poor quality eggs. And when I say poor quality, like our goal is to make as many good embryos as possible. And if you only make one or two, that's maybe not ideal for an intended parent. So that's why that 34 top age is there. We know that certain toxins and lifestyle maneuvers can affect egg quality. So we try to minimize those in egg donors. When it comes to medical issues, like we want the egg donor to be safe. Like we want her to be able to go through this seamlessly, have a good experience and not have complications. And to have a good outcome with healthy eggs. And again, so that's why certain medical conditions are kind of excluded or we don't love it. Normal BMI, that's a tricky one because, there's lots of data on whether obesity impacts ovarian stimulation, egg retrieval success. Some data says it doesn't impact at all. Some data says it does. And so again, we need to have certain targets. Mental health history is interesting because more and more we're finding out that mental health can be somewhat hereditary. Like there is some component that could be hereditary. It's probably multifactorial, some situational. So when we look at egg donors who maybe have had multiple family members who've had mental health concerns, we just think about this a little bit more in terms of whether it is important to disclose to the recipients and could be an issue, in terms of propagating genetic risk. But I like what you said there about emotional readiness for someone who is potentially, in an active stage of anxiety or depression, like, are they going to be able to handle the egg donation process? And again, it's all for making this seamless and easy to handle for the egg donor as well. We want a happy intended parent and a happy egg donor. Any other medications that an egg donor is taking, some of these can be toxic or not good for eggs. So sometimes you can just stop them and proceed with egg donation. Sometimes it's not possible. So again, all of this is to ensure a healthy cohort of eggs for the intended parents, but also to keep the egg donor safe.
Thank you. I actually have a question specifically about genetic history. Part of becoming an egg donor is having some genetic screening done. If there is some sort of abnormality that comes up in a genetic screening, do donors have to know that information? What if they choose not to want to know, some of the information about their genetics or some things that might come up in the screening process?
So are you asking about whether we need to disclose the genetic results? So first, let's start to talk about why the genetics are done. So this is like, when I say relatively new, it's like in the last 5 to 7 years that we're doing genetic screening of egg donors and intended parents. And I think a lot of this is like, remember, an intended parent is using an egg donor who is not part of their family, right? They don't know them, and vice versa, right? So without that background, it's like, how does everyone feel safe that they're not going to propagate any genetic disease? So now we're lucky we're in this like new wave genetic world where you can do like 23andMe and things like that. So now there's these incredible genetic screens that you can do on people to see if they carry any background mutations. So our goal, sorry, I'm just getting a call from the service. I gotta mute for a second. I apologize.
No worries. Okay? While we wait for Dr. Sharma to take her call, we'll just go ahead and talk. We'll pause there. We'll talk a little bit about the egg donation journey. So, Amber,
I would actually like to kind of add on to that, what she was talking about. As an egg donor, personally, I ended up learning a lot about my own genetic history that I would have had no access to if I didn't become an egg donor. So I learned I was a cystic fibrosis carrier, which in turn, I had already had a child, and thank goodness he didn't come back with that. But we didn't know if my husband was a carrier. And having my daughter, she came back as a carrier as well. So to know both of our histories, especially for her, once she's old enough to choose to have children or not, we now know. We know that I'm a carrier, so it's something that can be passed down through the bloodline. And yeah, if I wasn't a donor, I would have never had known that. So I think it's pretty cool, the health things that you get a package of all of your testings and everything like that you wouldn't normally get from your GP. So it's pretty neat to have that on hand.
That is so incredible. That is, it is make that informed decision and to be able to have that information, which is not often readily accessible or available to just, the ordinary person. But yeah, so as a journey guide, the donor comes in or potential donor comes in and they do what? They fill out an application. What kind of information is like on that application?
Yeah, so if you are signing up on our website, or maybe you found us on an ad, we're going to have some general questions, maybe your age, what province you live in, what city you live in, because that can be very helpful for travel, and just some basic contact information and asking how you would like to be reached. We're typically going to reach out to you and just say, hey, like, so cool, you signed up. My first step would be to get you on a phone call so that we can have a very informed conversation on the whole process and to ensure all of your questions are answered before you make a decision. And then from there, we can hop into the first steps if you're ready, which would include a detailed profile and then getting your blood work for your anti-Müllerian hormone out of the way to determine if you're able to match with intended parents. So that's also another cool factor, is that's a test that is going to tell you a lot about your fertility as well.
Amazing. And so when filling out that application, like, what kind of tips do you have for someone? Is there information that they should maybe be gathering beforehand, that they should come prepared to have?
Yeah, so a lot of it can be your personal information, but there is going to be a medical portion that does ask about biological family members. So your closest ones, mom, dad, siblings, grandparents. If there's anything hereditary, maybe different cancers that have run through your family, and things like that. So it is pretty important to know that. Like Dr. Sharma said, you will go through further genetic testing down the line, but any information that you might have from the beginning is very helpful for not only the doctors, but for the intended parents to have that profile to maybe put away for the future as well.
That's fantastic. And then what if someone doesn't know one of their parents or doesn't know one of their grandparents? Can they still
Yeah.
apply? They can just add that
Yeah,
in.
of course. So we have donors that are fully adopted, and they have been successful donors. You will go through some genetic testing and everything like that. It can be a little bit trickier to get matched if those intended parents are looking for a full panel of wanting to know everything, but it's not impossible. So we still do encourage you to apply.
Amazing. So they've completed that initial application. They've been kind of approved on paper. They go into a database. Can you talk a little bit about like that database, what the waiting time could possibly look like?
Yeah, so our database is not your whole profile. It's a very shrunken down one. It takes out any personal information, names, even where maybe you went to school. Especially if you're wanting to do anonymous donation, you're going to want as much of that personal information out of there. And we have a great database that gives the information that's needed for intended parents to make that informed decision. You get to outline also as well what you're comfortable with when it comes to a known or anonymous, so they can read that and make a decision based on being aligned that way, as we want everyone to be comfortable moving forward and being on the same page.
Perfect.
Sorry,
And
guys,
then,
I'm back. That was an emergency call. Just I had to take. But did I not complete my thought from before?
we were just talking about genetics, but we'll actually
I think that genetics, if you've gone through, but basically in terms of disclosing to an egg donor, I mean, I don't know, that's a tricky point. We do the genetics on the egg donor and the intended parent. I guess if an egg donor didn't want to know, we wouldn't have to tell her, but it's kind of like medical disclosure that we should let them know. And this genetic screening is called carrier screening. So 99% of the time, it doesn't actually affect the donor. And she wants to know because if she's going to have kids in the future, she should know that to test her future partner.
Yeah, Amber shared a little bit about her own personal experience with that, so that was super helpful. Is there any kind of genetic counseling that donors need to have then before the screening?
I mean, not really. I mean, as a physician or the health professional who talks to them initially, we will say that we're doing this genetic screening on you. Something might come up. This is what it could be. And you know, certainly if they want to speak to a genetics counselor, that could happen at any of our clinics for sure. But it's just information that they should know.
Perfect. And Amber was talking a little bit about the process, and she did mention that we screen for a test called AMH, and then we also will do an AFC, which is anti-Müllerian hormone, and then intrafollicular count. Can you talk a little bit about what those tests are, and if they come back and someone's not eligible for a donor, does that mean that they should be concerned about their fertility? Or
yeah. So when we look at parameters in terms of egg health and egg quality, you're right that there's three big things. One is your age, being in that 18 to 34-year-old window ideally. AMH is a hormone that's produced by the ovarian follicles, so normally we want that to be in the normal range, which is 15 to 28 or more. And antral follicle count is the egg count on ultrasound or follicle count, and ideally we want that to be in the 15 to 25 range. The reason for that, again, is the same, that we want to maximize the egg yield from one egg retrieval, which should be 15 to 25 eggs, ideally. It's not to say that, and listen, I've done this myself, it's not to say that we wouldn't stimulate a 37-year-old egg donor who has only 10 follicles if that's what the IPs wanted, but we need some parameters when it comes to choosing ideal egg donors. So yes, the situation has happened where an egg donor does her screening counts and we're like, you're not eligible because your AMH is low and your antral follicle count is low. I think one of the very important things to note is that you are not you shouldn't be valued at your AMH. So we know that in the non-infertile population, AMH levels don't necessarily mean anything. If you're 32 years old with a low AMH, it doesn't mean you can't conceive naturally. So I wouldn't get too attached to that number. However, listen, it's your opportunity. It's the donor's opportunity to find out more about their reproductive health. So as an egg donor who's maybe 28, if they have a low AMH, it might be an opportunity, even if they're not going to become an egg donor, to say, hey, I'm single. Let me freeze my eggs in case things change in the future. I don't have kids for some time. So I try to spin all of this in the positive light, saying knowledge is power. And even if you might not have any issues later, like use this as a chance to get some information about your body and be able to plan your own reproductive future.
Yeah, absolutely. And then Amber, we were talking just quickly a little bit about the matching process. So you had mentioned you go to a database. Most of your information is hidden. It's only information that is directly needed by the intended parents to make a decision on if you would be the right donor for them. And you can choose to either be known to the intended parents or anonymous, right? So if someone's to pick an egg donor from the database, how am I alerted as a donor? What does that process kind of look like?
So we will reach out to you right away. There's a couple steps the intended parents need to take first before we can confirm all the details. Once we confirm and everyone is ready and a go, we will send you some documents to sign. And then we send the match sheet into the clinic and everything becomes real from there. And that's when the clinic's going to start to reach out to you to book you in for your first initial appointment.
Amazing. So the clinic's booking in that initial appointment. At that appointment, you're doing the AFC, correct, Dr. Sharma? What else are you doing?
Got it. Well, sorry, to go back, if you're a new egg donor, you'll have an initial virtual consult typically, or an in-person consult with one of the healthcare providers just to get your history and whatnot. And then you come in for your medical screening, which involves pelvic ultrasound and blood work. Usually there's a counseling appointment as well. And that's kind of the full medical screening. Urine tests for STDs, things like that.
Mm-hmm. And Dr. Sharma is a clinic that we work with the most, and you guys are located downtown Toronto. So Amber, if I'm a donor and I'm in Winnipeg, I'm interested, what does your team do? How do I get to Toronto?
Yeah. So it's pretty exciting actually. You can bring a friend with you as well if you want to, and we will put you up in a hotel or Airbnb nice and close to the clinic, and everything is booked for you, your flights, accommodations, so you don't have to worry about the stress of all of that. And during the time that you stay there, you have a beautiful big city to explore as well. So it's kind of a win-win for everyone, I think.
Yeah, lots of fun things. And so you've gone to the medical screening appointment, you go into the phase called like our legal contracts matching. What's involved in that?
So for the legal contracts, that's where all of your details are going to be outlined. And this is to ensure all parties are protected before any medications have begun. So all of your donation details will be outlined in there, your rights, the intended parents' rights, your reimbursement agreement, your relationship agreed upon. There'll also state things in there that you do need to abstain from while you're on the hormone injection. So like I did mention earlier, the alcohol, tobacco, drug use, sexual intercourse is a big one as well. And our lawyer team is amazing. They go over everything in such detail, and that's a great time to also ask your questions and make sure you're informed, and ensure that every detail that you also want is put in there too.
Yeah, and we have lots of information about the legal contract phase and the legal process. So reach out to our team if you want more information about that. Today, we're kind of focusing on the medical side. So we'll skip past the legals and just cover the basic, and talk more about the actual cycle. So you've matched with intended parents, you've had your screening, you've done the legal contract. The first phase is the stimulation period. Dr. Sharma, do you want to talk a little bit about what stims means? What do you do as a donor?
Yeah. So again, going back to our discussion about the menstrual cycle, and taking exogenous gonadotropins, those are the medications that are given to help stimulate multiple follicle development. And it's an FSH and an LH. So typically this is like anywhere between 1 and 3 injections a day for about 10 to 12 days. You're injecting in your tummy. They're not bad. Like our donors are able to do it. So you're injecting daily, typically on day 2 or 3 until day 11 to 12. about 10 days. You're coming in for monitoring every couple of days to see what your ultrasound and blood work looks like to assess the follicular growth, as well as your estrogen levels. At the end of that 10 to 12 days, we say the follicles are big. Usually you feel kind of bloated, breast tenderness, nausea as the follicles develop, but it's not terrible. We trigger ovulation and we do an egg retrieval 35 hours after the trigger. That's a well-timed trigger shot, so very important to take it at the right time. And then we do the egg retrieval under sedation. You're asleep. You shouldn't feel any pain. Eggs are taken out, handed to the laboratory for fertilization, and so on and so forth. It's 2 weeks of your life. Like, I will not say it's the easiest thing in the world. Like, I'm the first to say that, you know, I'm impressed by how egg donors do this, and some of them time after time to donate multiple times. So we applaud and appreciate those who do it. But the protocols have become much more simplified over the years. And I think they could even be more simplified. There's lots of protocols out there that we'd love to use more often. And we try to make it as easy as possible for the donors.
Amazing. And Amber, if you're still here, could you talk a little bit about your experience as an egg donor? Dr. Prouty said that there are some injections. Like, you know, how did that feel? Do you have any tips for managing becoming an egg donor?
Yeah, so obviously my first time was very nerve-wracking. I'd never had even held a needle or used one before. So obviously the first time you're going to do it, there's going to be some nerves, and that's so normal. And something else I would like to add is all of the Egg Helpers team have been donors. So if you need someone on a FaceTime or just someone on the phone to encourage you and help you, we are all here for that. We've all been there, and we totally understand that first time experience. But honestly, after that first one got out of the way, it was just became a daily part of my normal routine for 2 weeks. Super easy. I will say I didn't feel any symptoms or anything until maybe 4 to 5 days before my egg retrieval, which was nice. And I did produce quite a few eggs. So the bloating and cramping for maybe 48 hours after my retrieval was uncomfortable, but nothing that a heating pad and some rest couldn't help. So it's really not that bad, not to diminish anyone who might have had a different experience, but it's very quick. It's a quick 2 weeks. And we have so many returning donors, so it can't be that bad, right?
Totally. And I went through my own egg retrieval, and so I totally also get it. The needles were one of the things that freaked me out the most about this. But there's so many tips, and one thing that I used for myself was I was able to buy numbing cream, and I applied the numbing cream 30 minutes before I was doing my injection, and I had someone else do it because total needle phobia over here, and it was didn't even feel it. You know, I just went really slow. I put the numbing cream on, and I really did not feel anything. So you can ask our team about what numbing cream works, and we can show you, but every drugstore carries it.
Yes.
And then again, for just like managing like some of the emotional side effects, some of the physical side effects, emotionally, for me, I felt kind of like I was on a heightened period. Like it was like kind of like I was about to get my period and I was feeling a little bit more emotional. I think that came a little bit later in the cycle for me, but I'm not sure about you.
Yeah, I would say same.
Yeah.
But, and you know, if it's safe to do so, tell the people around you so you have support. We also offer counseling through Egg Helpers. I'm sure the clinic and the nurses and counselors there would be happy to talk to you if you are feeling any sort of way. Like we said, you're doing an amazing, amazing thing, and we want you to feel supported throughout the whole journey.
Yeah, I think just lots of self-care, watch all the shows you want, do all the fun things in Toronto that you want. If you have to have a partner or a friend come out and do the donation period with you, have that support, to have someone do the injections for you, totally okay. Like this is also about you. And so whatever you need or whatever feels like too much, ask our team and we're happy to guide you or give our own tips.
Yeah, feeding pads, support. You're allowed to take some, electrolytes, pain relief medication is allowed to be taken. A high sodium diet also helps as well. So ask us for all the tips and tricks. That's what we're here for.
Yeah.
I think it's worthwhile like talking about OHSS for a second, because there's been like
that's actually
there's always a lot. Yeah, there's always a lot out there, and I like to mention it only because sometimes it's also like the fear of the unknown, right? And so look, OHSS is a thing, especially for egg donors, because they have the potential to make a lot of eggs. Most of us as physicians are very cognizant of the risk of OHSS, and we have like our guidelines as to how many eggs we want. But egg donors are like, they're egg machines. Like they make a lot of eggs, right? So sometimes egg donors will respond a little bit more than we expect. And so we say 15 to 25, but truthfully, it's probably like 25 to 35 eggs that egg donors are making just because they're hyper responsive. So there's a difference between ovarian hyperstimulation and ovarian hyperstimulation syndrome. So the symptoms of feeling what you said, Amber, at the end of your stimulation, like bloating, breast tenderness, nausea, feeling really full. I think every one of my IVF patients, I want them to feel like that because that means they got enough eggs, right? By the end, they're like, I'm ready to get those eggs out. So that's normal. Everybody feels that during IVF. What we don't want is the syndrome, which happens after the egg retrieval, where you can't move, you can't walk, you can't pee, you need fluid drained out. And we have lots of protocols in place to reduce the risk of that. And like things have become revolutionized even in my lifetime. Shorter protocols, antagonist protocols, something called an agonist trigger, post-op meds to prevent OHSS, monitoring. So I would say it's incredibly rare now. So, if you Google like IVF, you're going to see OHSS right next to it on your AI like clog, just because they go together. But the real true risk of ovarian hyperstimulation syndrome is hopefully very low in capable hands. And so the symptoms of ovarian stimulation are different for OHSS. And so I'd like to say, just as a fertility physician who does this day in, day out, like we're still very cognizant to make sure our patients do not develop ovarian hyperstimulation syndrome, even though we want our intended parents to get enough eggs. So yeah, don't think that we ignore that. We're very conscious and aware, and we don't want our patients to get OHSS.
No, that's fantastic. It is absolutely real. I was going to say we were going to, in this slide, just talk about some of like the risks and considerations. This is maybe more so around like the egg retrieval, whereas that would happen. When would you kind of notice symptoms of OHSS?
Yeah, I mean, I think it's OHSS really only occurs post egg retrieval, but if you are feeling like really crazy bloated on day 5 of stim, it could be that you over responded and your estrogen's really high and the dose needs to go down. So one of the things I would tell egg donors or prospective egg donors is like, don't feel like, oh my God, I can't say anything because, you're like, I want the cycle to be perfect for my intended parents. It's still your body. So if you're like, this feels weird, I'm like super duper bloated on day 4 of stim, say it. Like, it doesn't hurt. Say it to your nurse, and then your nurse will alert the doctor. We'll look at your estrogen levels. We might be like, let's drop the dose a little bit, right? Like, don't feel bashful. So you might start feeling symptoms because you're on your way to overstimulating early on, and that's where the estrogen levels, the monitoring, and the donor symptoms matter. But quite typically, if things are progressing as we expect to that 15 to 25, 25 to 30 egg level, if you are really getting hyperstimulation, yes, it'll be felt more after the egg retrieval once we get out the eggs. If you're just persistently bloated for the week after the egg retrieval, again, don't be bashful, come in, get evaluated, because we want to be ahead of the game. If you are developing OHSS, we want to start treating it early. But going back a little bit, as you said, we talked a lot about OHSS, but I think as a donor, and I would be the same, I would worry about, oh my God, the retrieval, it's a surgery, is it going to hurt? You're getting out the eggs. So egg retrievals are done under sedation. It's called conscious sedation. You get an IV, you're put to sleep. You should be well sedated. Like, there's no reason why you shouldn't. So you will get enough meds. It's not a long procedure. An egg retrieval typically takes under a half an hour. It's like 10 to 20 minutes, beginning to end. As long as the access to the ovaries and everything's fine, which it usually is. So it's not a very long procedure. You should be well sedated. You can ask for more meds if you want, if you feel it. Our nurses are very good at noticing if the egg donor is in pain and needs a little bit more. We're very liberous with sedation. Afterwards, like, listen, it's not a complete walk in the park. You will feel cramping that day and some, lower abdominal tenderness. It shouldn't be crazy or out of the ordinary. What are the big risks? Bleeding, infection, damaged structures nearby, twisting of the ovaries, which is ovarian torsion, or OHSS. Again, thankfully, these are in the single digits, like less than 2% chance of this. But it's not completely without risk. So, we're always very open about telling egg donors that, but fortunately, it's very rare.
That's perfect. Amber, as someone who's gone through an egg retrieval, can you talk about what it felt like? Did you feel pain? How long did it take you to feel back to normal?
Yeah, so the only, like, for the actual egg retrieval, nothing. Like, Dr. Sharma said, they make sure that you are well medicated, you're feeling good. And it was mostly after, for the like 24 to 48 hours of just discomfort. You can kind of feel maybe where they poked around and some cramping and some bloating. But if you just relax, take that time, maybe book the next day off work so that you can just hang out, within a few days, you should be feeling back to your normal self.
Yeah, I totally agree. I didn't feel anything through the egg retrieval, bit of cramping afterwards, heat pack, favorite snacks, and
Yes.
you were actually a princess for the rest of the day. So
Exactly.
done something really hard. That's fantastic. And then, Dr. Sharma, after the egg retrieval, what should donors expect for their own return of their menstrual cycle? Is that cycle any different?
Yeah.
When are
I mean,
they fertile
anytime you
again?
take hormones, you might be thrown off a little bit, but
Yeah.
typically your period will come within 7 to 14 days of the egg retrieval. Oftentimes it's sooner than you'd expect, and that kind of shocks an egg donor. And that's because when you take this agonist trigger, which is the trigger to prevent or reduce the risk of OHSS, your period just comes sooner. You get it like 8 days later. So don't be alarmed by that. If not, if you get a dual trigger, it's 2 weeks later, but within 2 weeks, you should get a period. The other thing I would just throw out there is no unprotected intercourse after an egg retrieval, especially if you have multiple eggs. You don't want to be surprised by a twin pregnancy because there were eggs in there still.
Yes, that's great. Thank you. Okay, as we're just like wrapping up here, reflecting, what do you wish egg donors knew, Dr. Sharma, before they chose to become an egg donor? What does like informed decision making look like? Anything that someone should consider medically before doing this?
Absolutely. I think for egg donors, it's important to ask all the right questions early on. I think webinars like this are excellent because I think there are still some egg donors who go into this process, especially new egg donors, and they feel like they don't know everything about the process. So I think this is really great for someone who's considering becoming a prospective egg donor, because this is like half the battle, having some knowledge when you go into that initial consult. There's no silly questions, so ask all your questions. I mean, I would say it's good to go to a clinic that does a lot of egg donation. One is just for the coordination and making sure you get all your testing and you don't have to come to the clinic a million times to do all your screening tests, and that there's no delays in the egg donation moving forward. And then just in terms of stimulating egg donors, it is a bit of an art to make sure they don't overstimulate or understimulate. So you want to be somewhere where, you know, the doctors are very familiar, the clinic is very familiar with the process. You want to know who your care team is. You want to make sure if there's a problem, you know who to be able to contact. If you don't have your medication, if you have a question about injecting the medication, or if you have pain or something's going on. So those are all important things. Yeah, like make sure you fully understand the process, because this is still a medical procedure and it's something that's happening to your body. So no question is over dramatic or anything like that. You want to make sure you're well prepared. And I agree. I think, Amber, you said it, like having that support system is also very important, right? Even though the protocols are now tailored to be very reasonable, you're still taking injections, like you're still feeling hormonal effects, and you're undergoing a procedure where you're getting sedation. So it's really good to have someone around who knows that you're doing this, who can pamper you throughout the process.
Totally. And then, Amber, from your perspective, like what's something that maybe surprised you about the process? What have you heard from egg donors that surprised them about the process, or something that maybe you wish you knew?
It's a good question. Yeah, I think it's the first time doing hormones and stuff. It can just be everyone. I talk to a lot of donors who want to know exactly how they're going to feel, exactly the whole process they're going to go through. And I will say it's an individual process. Just because I had a great experience and maybe I didn't feel any symptoms doesn't mean the next person isn't going to feel those, maybe to an extreme. So just advocate for yourself. And like Dr. Sharma said, you have such a big team behind you. Tell people if something doesn't feel right. No question is stupid or any. I will say my favorite donors are the ones who are texting me random questions. You have full access to our team. You can text, email, call. So there's no reason why you shouldn't have someone you can't get a hold of. If something is not feeling right, if you have a silly question, ask it, because we want you to be informed. We want you to feel good. We want you to feel like you have a friend through this process as well. We've all been there. So yeah, I think just knowing that your experience is going to be different to maybe your friend's experience or the next person experience. We are all made differently.
Yeah, that's like the biggest thing that I wanted to say is just like I was surprised how individual this process is. Like I
Mm-hmm.
feel like I heard every story about or egg retrievals or egg donations, and mine personally was very painless. I felt very good, and
Mm-hmm.
so don't be scared of like what you hear online. Sometimes I think there's things that float around on TikTok or on Instagram, and those aren't coming necessarily from Canadian clinics, right? Where
Yeah.
our system is a lot better, or it could be outdated information. Everybody's just different. So
Mm-hmm.
ask our team, ask about our team's personal experiences, ask our fertility doctors that are available, our lawyers, and yeah, I agree.
Yeah.
So
Everyone's here to work for you. So
yeah, very last thing, next steps. Okay, so someone's made it to the end of this webinar. Amber, how can someone connect with you? What do they do from now?
yeah, so I'm sure at the end of this there will be a link. You can book a phone call with me. We can get on the phone. We can go over all the steps, all of your questions. I will send you detailed information packages, and we will kind of just decide together if this is the right step for you on how to get started. I think it's a great experience to even just learn about your own personal health that you might not know about on a normal daily basis. So it doesn't hurt to try.
I agree. Thank you guys so much for being here. Thank you, Dr. Sharma, for taking time out of your busy
No
day.
problem. And thank you to any potential egg donors that hopefully we've helped and are encouraged to start this process.
Yes. Thanks,
Absolutely.
everyone. Bye-bye.
Thanks. Bye, guys.